Welcome to my channel. Today's topic is nursing diagnosis for respiratory system. We already seen that fever nursing diagnosis in the first video. Today we will see nursing diagnosis for the respiratory system. First nursing diagnosis, ineffective airway clearance related to retained secretions or excessive mucosa production as evidenced by ineffective cough or adventitis, breath sounds or dyspnea. Here the airway is not cleared because secretions is there. Secretions will produce the breathing sounds and it may cause the dyspnea. This is the primary most important nursing diagnosis for all respiratory conditions. Next one, second nursing diagnosis, ineffective breathing pattern related to inflammation and pain as evidenced by dyspnea, tachypnea, nasal flooring and altered chest exhaustions. Here, ineffective breathing pattern, that means tachypnea and bradypnea, these are the two ineffective breathing patterns that may be seen in the inflammation or any medical condition or any surgical condition. The patient may experience the dyspnea, tachypnea, bradypnea. So this is the second nursing diagnosis for respiratory system. Third nursing diagnosis for the respiratory system, acute pain related to inflammation or rapid breathing or impaired gases exchange as evidenced by patient reports of pleuritic chest pain and presence of pleural friction, rub and shallow respirations. Here the patient may be having the pain because of inflammation or maybe rapid breathing or impaired gases exchange. So the patient experiences the pain because of the friction, rub, fluoride in between the pleural wall. In the presence of friction that may causes the shallow respirations. This is the third important nursing diagnosis for respiratory system. And next one, fourth nursing diagnosis for respiratory system is impaired gas exchange related to air or fluid collection in lungs and pleural space as evidenced by drainage from the chest tube and decreasing of breath sounds and abnormal pulse oximetry. Means gases exchange, oxygen and carbon dioxide exchanges is altered here because the fluid or air collecting in between the lungs and the pleural spaces. So that pleural spaces was filled with the fluid was drained by the chest tubes, and the chest tube will be present means the decreasing of breath sounds and abnormal pulse oximetry may be seen. And next one, impaired gases exchange. This one we can write, or we can otherwise we can write as impaired gases exchange related to alveolar hypoventilation as evidenced by headache. And fifth nursing diagnosis is this nursing diagnosis, all the respiratory conditions there is a imbalanced nutrition because of lack of taking of proper nutritious diet. The patient will be experience that imbalanced in the nutrition. So that respiratory condition is the main nursing diagnosis as the imbalances of nutrition. So we can formulate this imbalances of nutrition less than the body requirement related to poor appetite or loss of appetite and lowered energy levels or dyspnea and gastric distension, sputum production and depression as evidenced by weight loss, decreased serum albumin levels and lack of interest in the food. In these we can write imbalanced nutrition because of lack of appetite or gastric distension. We can choose this any one or two. We can choose any poor appetite or loss of appetite or lower energy levels or gastric distension, any one we can write, and we can write as last evidence of weight loss, so because of lack of interest in the food. So this is the nursing diagnosis based on the nutritious diet. So all the respiratory conditions, patients are suffering with respiratory problems, they are not interested to take a nutritious diet, so maybe they experience that loss of weight and poor appetite. These are the nursing diagnosis for the based on the nutrition. So these five are the main important nursing diagnosis for the respiratory system. First one, ineffective airway clearance, and next one, ineffective breathing pattern, and a acute pain related to the inflammation or any breathing problems, impaired gases exchange, and last one is the imbalances in the nutrition. These are main and important nursing diagnosis in the respiratory system. Thank you.